8 p.m. last night, we had 1,405 cases of community transmission in New South Wales, and tragically 6 people lost their lives, and we extend our deepest condolences to their loved ones who are experiencing obvious grief at this time. I want to stress that whilst today the New South Wales Government is outlining our plan, our roadmap for the way forward in New South Wales, that we're definitely not out of the woods. We know that case numbers are likely to peak in the next week or so, and we also know that our hospital system will be under the greatest stress in October. However, at any stage, and this is consistent with the Doherty report, at any stage, if there's a concentration of disease in a town or a suburb or a local government area or an outbreak that wasn't anticipated, health can restrict movement and give advice to make sure we don't have a surge which is going to put too much pressure on our hospital system. I also want to stress that there isn't a specific date. We will get to 70% double dose when people get their second dose, when people come forward to get vaccinated, and these freedoms will come into place the Monday after that occurs. Now, in relation to schools, we always had to choose a fixed date because unlike other venues and unlike adult activity, it's really important for school communities, for students and teachers to have a fixed date they open to provide absolute certainty, and that's why we nominated the 25th of October. We assumed, and I think that assumption will bear fruit, that by that stage 70% of adults would be vaccinated and there'd be some start of vaccination for 12 to 15-year-olds.
But for regional rural New South Wales today, vast amounts of the regions will open. Mid-North Coast to the North Coast to the Northwest, Albury to Riverina and Murrumbidgee areas, but parts of regional New South Wales won't open. The southern part, southeast, the Illawarra, Shoalhaven area, the Hunter region, Central Coast, out to the Central West, parts of the Far West won't open today, and that's based on the work that we've done with health, looking at parameters around how you can lift restrictions and open up the regions. For those areas that are coming out of lockdown, you are not coming back to a pre-lockdown environment. There will be capacity limits for our hotels, cafes and restaurants, including the 4 square metre rule, mask wearing, social distancing. There's rules around certain activities that won't recommence. Community sport won't be permitted. But the opportunity to get back to retail shopping, back to work, back to enjoying time with family and friends. It is still a restricted environment because we know through sewage surveillance and our surveillance there is seeding across the regions, and there is a risk that the COVID pandemic continues in regional rural New South Wales. And I need to make this absolutely clear. For all those communities that are coming out of lockdown today, it is a nice feeling. But if there is an active case in your community, you will go back into lockdown for a minimum of 14 days.